Hi, I'm Laura. I go to YTI Career Institute for Respiratory Therapy. I'm going to talk to you today about the importance of social support during pulmonary rehab. When most people think about pulmonary rehabilitation, the first things that come to mind are exercise and smoking cessation. Social support and support groups are often forgotten about, but they play an important role in pulmonary rehabilitation. Support groups are for people with diseases of the lung and their families. Participants learn about their disease and share ideas and solutions to their problems. Most people are unaware that depression and anxiety are common in patients with COPD. They are often undetected, undertreated, or even untreated. This can lead to increased mortality risk, reduced compliance with management plans, impaired health-related quality of life, slow recovery from exacerbations, and increased healthcare utilization and cost. Psychosocial and behavioral intervention focus on specific problems such as stress management or instruction in progressive muscle relaxation and panic control. Throughout doing research, I realized that stress management was a big thing with pulmonary rehab. I thought to myself, that totally makes sense. A lot of smokers, when something stresses them out, they feel like they're going to have a panic attack and they say, I could really use a cigarette right now. I've even heard smokers tell their doctor that they absolutely could not stop smoking because the stress will lead them to kill someone or even themselves, but a cigarette is all it would take to calm them down. The exact cause of depression and anxiety in people with COPD is unknown. However, some causes are thought to be physical disability, long-term oxygen therapy, living alone, and low social class status. Think about it for a minute. Goals are easier to achieve if you have someone cheering you on, talking you through tough spots, or trying to accomplish the same goal. People without a strong support system often can't make it to their medical appointments, exercise programs, or psychotherapy sessions because they have physical limitations and need someone to help take them to make sure they can get there safely. There is such a thing as telephone-administered cognitive behavioral therapy that allows people to receive counseling therapy in their own homes. Some topics covered in therapy sessions are depression and activity tracking, activity scheduling, relaxation skills, and cognitive restructuring. The purpose of a depression and activity log is it helps provide insight into the connection between activity level and mood state. Engaging in more activities that bring a sense of achievement or pleasure can increase positive emotions and decrease negative ones. Depressed people tend to withdraw from everyday life, which itself lowers energy levels and reduces motivation, and confirms as a depressed person the view that they're best left off by themselves and should not bother with others. They often find it hard to do more than lie in bed all day. With activity scheduling, it helps them find a reason not to stay in bed all day and feel a sense of purpose and accomplishment when they get the activity done. Relaxation skills include deep breathing, imagery, and progressive muscle relaxation. During the flight or fight response, breathing becomes rapid and shallow. Deep breathing reverses that and sends messages to the brain to begin calming the body. Relaxation helps to reduce anxiety, which in turn helps to reduce the urge to smoke. Imagery is when you imagine that you're somewhere calming, helping you to relax. During the fight or flight response, the tension in our muscles increases, leading to the feeling of stiffness, back pain, and neck pain. Progressive muscle relaxation teaches us to become more aware of this tension so we can better identify and address stress. Relaxation helps to reduce anxiety, which in turn helps to reduce the urge to smoke. Cognitive restructuring teaches us to realize our negative thoughts and look at our thoughts realistically. For example, when a smoker says, I'm going to kill someone if I don't have a cigarette right now, they need to realize that it's a negative thought and that that's not what's going to happen if they have a cigarette. They need to realize that they will probably be irritable and on edge, but they're not going to harm someone else. With the help of social support and cognitive behavioral therapy, a person in pulmonary rehab can complete the program with confidence and time.